All right, you guys, in today's health check, I've been speaking with a lot of local medical experts to get answers to some of the questions that you're asking. These are great questions, by the way. First, from a bakery shop owner via Instagram who asks, the governor had metrics when we had to meet to open more businesses, and now those metrics, like no increase in cases for 2 weeks, just seem to have disappeared and they don't matter. Why? So I had a conversation with Governor Greg Abbott's communications director for this one, John Whitman, who says, first, the governor is working with doctors to open the state safely, underscoring the fact that we are not in phase 2 right now. We're still technically in phase 1. He says when considering what to open and when, the governor and the team look at data. That includes daily numbers, but also they look at the trends, like the number of people testing positive compared to the number of people testing overall. Also, they're looking at deaths overall, which he said are one of the lowest death rates in the country. And finally, he said they look at hospitalizations. And while that number has fluctuated here and there, it has largely remained steady through the pandemic in Texas, and hospitals still have capacity. Now, the hot spots that they've identified are nursing homes, prisons, and meat packing plants in Texas. And the state is using surge teams to go into those places and make sure there are ways to control infection rates there. The bottom line for that bakery owner and employers across the state, as well as consumers really, permission to open is not a mandate to open, and this is why all of us really need to keep up with appropriate social distancing and wearing those masks to avoid spreading this thing to at-risk people. All right, next question. Tammy from Facebook writes, I cannot take the flu vaccine. I worry if I'll be able to tolerate the COVID-19 vaccination, and if I can't, what does that mean for my career and, most importantly, my family? Well, Tammy, I got Dr. John Carlo and Dr. Mark Casanova to weigh in here. It's important to remember, you guys, vaccines differ, and this coronavirus is a different viral strain. We're also likely months from knowing how the coronavirus vaccine will be made. It is very likely as well that it'll be completely different from how the influenza vaccine is made. We do have, thankfully, many different vaccines for a variety of childhood and adult infections that are proven continuously to be very safe and effective. And of course, hopefully we can add a safe and effective coronavirus vaccine in the near future, but we gotta hold off and be patient on this one. Isela from Facebook asks, my son has already had Kawasaki disease, and so now I'm more concerned that he'll get COVID-19 and it'll be worse than the norm. Is he more susceptible to getting COVID-19? I asked a lot of doctors about this one. This answer coming from Dr. Clint Haley, infectious disease expert from Baylor Scott & White, who says, look, the reason this is all in the news right now is that COVID-19 appears to cause a Kawasaki-like inflammatory condition in a very small percentage of children. Now, traditional Kawasaki disease is very rare, so we don't know with certainty if those children with prior Kawasaki disease are at an increased risk of complications from COVID-19. But in one study of kids with COVID-related Kawasaki-like syndrome, the majority, 83%, had underlying health problems like congenital heart disease or other illnesses like cancer that would compromise their immune systems. So I know it's getting very complicated, you guys, but you're asking fantastic questions. Thank you, and keep them coming in. You can always email me or we can catch up on social media.